Now we're going to talk about transmission and pathogenesis of parasitic infections. I'm Dr. Manal Salahuddin, Professor of Medical Parasitology. The second part of our lecture is about host-parasite relationship. The relationship between a parasite and its host, where the parasite benefits and the host is harmed, is called parasitism. Okay? If you look to these two pictures here, this is the mosquito. It is a bloodsucker, and if you can look carefully, her body is red. It's full of blood from this patient. And the second, it is a worm. It's a round worm. By its mouth, it is eating from the intestine and taking its blood meal and causing intestinal erosion in the intestine of man. So the parasite benefits and the host is harmed. That is parasitism. Okay, establishment of a parasite in its host is called parasitic infection. So what's parasitic infection? It is the establishment of a parasite in its host. The outcome of this parasitic infection is 3 points. Either a clinical disease, whether acute or chronic form, or a latent infection where the pathogen remains in the body dormant or sleeping without any activity, without passing its infective stage in excreta or nothing. It is sleeping inside the body. Dormant or sleeping stage, it is called latent infected. And then it becomes active again due to other factors where it is then manifested later on. And the last form or the last outcome of parasitic infection being a carrier state, which I've mentioned, where this host he is without symptoms, however he sheds the infective stage in his excreta. So he is a source of infection to others, although he is without symptoms, asymptomatic. Then for the parasite, in order to survive and live in or on the host, the parasite must adapt itself to the surrounding environment. The parasite undergoes different changes, such as morphological, behavioral, or physiological changes or adaptations in order to be able to survive in or on the host. These criteria changes, which facilitate the parasite to adapt to its host, are called parasitic adaptations. Just an example, the parasite has hooks. You can see in these three figures. There are hooks in the first one. There is teeth, in the first one, and then hooks in the middle one, and then suckers for attachment in the third last one. Okay, these are an example for parasitic adaptation. It changes its morphology to have teeth or hooks or suckers in order to be able to attach in its host. Okay, inside the host, the pathological effects by the parasite, such as host tissue damage, stimulates the immune response by the host, and you've taken the immune response by the host to parasitic infections in another module already. Okay, these 2 points result in parasitic infection, which may be with symptoms and signs. Okay, please answer these 2 questions with me. In parasitism, both the parasite and the host benefits. True or false? Rules, of course, to set parasitism, the parasite benefits and the host is harmed. The second question, parasitic adaptations are essential in order to survive in the host body. True or false? True, it is essential in order for the parasite in order to live or survive in or on the host body. This part of the lecture, we're going to talk about the pathogenesis of parasitic disease, the mechanism of producing a parasitic disease, or the mechanism which leads to the diseased state. Okay, the result from both points we've mentioned, the host tissue damage and plus the immune response by the host. Okay, the degree of host tissue damage depends on parasite factors and host factors. As for the parasite factors, there are 6. First of all, there is the strain or the strain of the parasite itself, whether it is a pathogenic or non-pathogenic strain. Let's say it causes a disease or does not cause a disease from itself. Okay, that's the parasite strain and virulence of the parasite. That's number 1. The second is parasite metabolic products, which will affect the host body. These metabolic products will stimulate the immune response of the host, and it can lead to allergic reactions. Then third, there is the site of parasite attachment. These 2 figures beside each other, you can see that there is a parasite in the liver and the bile duct, and another one, a parasite roundworm in the large intestine. So the site of parasite attachment differs and affects the degree of host tissue damage. Then we have the size of parasite. You can see these hands are carrying a single adult parasite, roundworm. A single one can reach 35 meters. Okay, so the size of parasite affects and it can cause obstruction to the intestine, the large intestine, for example. Then we have the ability of parasites for growth, development, and multiplication inside the host body, and this leads to the last point, which is the parasite burden. If it can multiply and develop to another stage and multiply inside the host, then it will its number will increase a lot, and this parasite burden will affect the it can cause occlusion or covering all the epithelium, causing inability to absorb our food. Okay, so these 6 factors affect the degree of host tissue damage according to the parasite factors. Then we have number 2, it is the host factors. Okay, there are also 6 points. The age of the host affects him, the gender or the sex, whether male or female. Some parasitic infections are more in males, others are in females. Then we have the genetic factors. There's, for example, people in certain area in the world, they do not get malaria or plasmodium, a type of plasmodium, or a certain protozoal infection because due to genetic factors in their body. Then we have the nutrition of the host. Malnourished people, of course, are more susceptible to infection, parasitic infection. Then the immune state, which is the most important one. And last, it is the occupation of the host, such as the farmer and schistosomiasis or bilharziasis, which make him more susceptible to come in contact with the infective stage, and so he will acquire this infection.